تحية طيبة للجميع وشكرا لإعطائي الفرصة لإلقاء هذا البحث في المؤتمر الرابطة السورية لعلم الأمراض. أنا إياد المؤذن وأنا مساعد أستاذ في كلية الصيدلة في جامعة اليوم. البحث اللي نحكي عليه اليوم هو Nanocarrier Sustained Calcitriol Anticancer Activity by Targeting Tumor Associated Macrophage. And I will start to present why we are working on vitamin D. Vitamin D, as you know, that it will be synthesized in the skin after sun exposure, or it can be given by the nutriment. It will be metabolized in the liver to then in the kidney to have the calcitriol, the active form of vitamin D. And this calcitriol, the active form of vitamin D, which acting on vitamin D receptor, and we found that he have some anti-cancer activity like anti-proliferative action. It induces cell differentiation and can have a pro-apoptotic action. So what is the clinical use of calcitriol in cancer therapy? We see that he have good efficiency in hormone-dependent cancers, including breast and prostate cancers. And the clinical use was tried a different therapeutic strategy, and they used usually the daily administration, but is limited by the hypercalcemia, as the dose that we need to administer it's a supravisiological dose. Another alternative, it was making a high dose, but with intermittent schedule, and it was giving a high dose weekly to get efficient level in the blood and have some anti-cancer activity, and we can evade hypercalcemia by administration one times each week. These strategies, when we use in clinical trials, have a limited efficacy at the end because it was not comparable with another strategic applied in the same clinical trials. For this reason, we think for the targeting and for long-acting delivery system, and usually we think more about nanoparticles. Why we need the nanoparticles and how we can formulate it. This nanoparticle was done by nanoprecipitation, and we have an organic phase, or we put it the polymer, calcitriol, and the oil, and then we pour the organic phase in the aqueous phase to have the precipitation and the formation of nanoparticles, which contain oily core and polymeric shell. And this nanoparticle can sustain the release of calcitriol encapsulated inside nanoparticle. And so we got nanoparticles would have a size near to 200 nanometer and negatively charged. So what we are interested during the formulation of nanoparticles is the polymer oil ratio. And with this polymer oil ratio can help us to modify the kinetic of release of calcitriol. And in this case, we compared different ratio, and we found that the ratio 1 to 2, it was a more interesting ratio, as have a more sustained release of calcitriol. And that meaning this nanoparticle could have a long-lasting efficacy of calcitriol. And we compared this different formulation on cancer cells to compare this activity of calcitriol, and we found, for example, the same things, that the ratio 1 to 2 is the most interesting ratio compared to other ratio, as we have a low number of cells, that meaning we have a higher anti-proliferative activity of these nanoparticles. So we completed with this formulation, and we try to see exactly the comparison of the formulation of efficacy compared of three form of calcitriol. So we try using human breast cancer adenocarcinoma, which is a MCF7 cell line, and we exposed these cells only 24 hours for nanoparticle or free calcitriol, and we compared the proliferation of these cells. So we didn't see a good difference at day 4, but after 7 days, we see that free calcitriol lose his activity, and the nanoparticles still exerts a high activity. And when we go to the day 10 after exposure, we see that there is no any activity was observed for free form, because it will be eliminated by the cells, or unless the nanoparticle still have a good efficacy and a different concentration. And this will could conclude that nanoparticle sustain calcitriol antiproliferative activity on breast cancer cells. We are also interested with the macrophage and to see how this macrophage can interact with nanoparticles. Why we are interested in the macrophage? Because these immune cells are presented in tumor and they participated in the progress of the tumor, notably for the invasion, for metastasis or angiogenesis. And these cells have the possibility to internalize nanoparticle as they have a phagocytic cells. So we see that nanoparticle, if we put it in the on culture of macrophage, we can see the nanoparticle labeled in red was internalized by macrophage, and also in vivo, when we injected nanoparticle intratumorally, we can see that the nanoparticle was internalized more by the macrophage than cancer cells. We try to evaluate our formulation, and we see that nanoparticle could be internalized by cancer cells, but they was highly internalized by macrophage. And if we go to the co-culture model, or we put it cancer cells with the macrophage and then added nanoparticle, we see that the two type of cells can internalize nanoparticle, but this nanoparticle, if we compared, was highly internalized by macrophage, and this nanoparticle was preserved inside the macrophage over 10 days. And that it will be very interesting, because that meaning if we administer nanoparticle and we arrive the tumor, this macrophage will be make as a reservoir of nanoparticle, and that meaning we have a very long-lasting action of these nanoparticles. To conclude, we finally tested the cytotoxic activity of calcitriol nanoparticles, and we compared the cytotoxic activity in monoculture, only the cancer cells, compared to co-culture, where is the macrophage and the cancer cells. And we applied that. We put it the macrophage, adding the cancer cells, then adding the nanoparticles. Then we check the cytotoxic action of on the cells. And what we see that, for example, the number of viable cells, the percentage of viable cells, we can see that at 4 days we start that the co-culture is more interesting than monoculture, and this action was very interesting after 10 days. That meaning this macrophage are keep the nanoparticle, and they permitted to nanoparticle to induce a longer psychotoxic activity. And that's it's very important and very interesting for the case of calcitriol, where we can administer once a week, but we can use this nanoparticle to release the calcitriol progressively. So to conclude, this work was integrated in the therapeutic strategy. It's immunochemotherapeutic strategy based on nanomedicine and their interaction with the macrophage, where the nanoparticles, when we administer for the tumor, could be act directly on the cancer cells and have a direct action, but it's a short action, and an indirect action by the macrophage, where the macrophage will internalize nanoparticle and they sustain the activity of nanoparticles, so we will have a long-lasting anti-cancer action. And also what we are working now, it should check if the nanoparticle and the calcitriol encapsulated in this nanoparticle can modulate anti-cancer immunoresponse. And in this case, we will use this macrophage to have work against cancer cells. And I hope to share these results maybe by the next meeting. So thank you for your attention, and I will be happy to answer your question if you can address by email that I put it under here. Thank you. شكرا لكم كثير.